Hi, for German television ARD, I hope I haven't missed it yesterday, but is there a reaction on the fact that the US government intends to stockpile doses of the remdesivir medication? And what is the European Union doing to safeguard stocks for, well, the member states in the European Union? Thank you.
Yes, thank you. And Oliver, apologies, I know you had said you had a question on the same issue, so we will try to provide you with an answer on that, and that is for Stefan. And Oliver, if you have a follow-up on that, we'll come back to you.
Yes. Thank you very much. Yes, indeed, we have reacted yesterday to the statements by the US authorities. First, I would like to stress that the protection of health obviously is a key priority for the Commission. This is one of the reasons why we're also speeding up the process to grant market authorization to remdesivir so that it would be available to citizens. We hope to have this market authorization by the end of this week. I'd like to stress also in this context that Commissioner Kyriakides has had multiple discussions with different pharmaceutical companies, including with Gilead, to discuss, for instance, production capacities. Now, at our level, the Commission is currently negotiating with Gilead the possibility to reserve doses, sufficient quantities of doses for the member states. I will not be able to say a lot about these negotiations, which are obviously confidential. That in our view, we all have to work together, obviously, to fight this virus.
Stefan, hold on one second. Hold on, because we have the alarm sounding off, not because of what you're saying, but simply because it's the first Thursday of the month. Thank you. No, now you need to turn your mic back on.
Yeah. It should be on now. Do you hear me?
Go ahead.
Excellent. Very good. Yeah, I was just finishing by saying that first, it's very important that we all work together in this fight against the virus, that we together develop a vaccine and treatments which are available, which are accessible, and which are affordable for all. Thanks.
Thank you, Stefan. Oliver, you want to ask a related question? Hold on one second. I don't know why, but from your side, the sound is very low, so we're going to bring it up. Go ahead.
Okay, that's good. I'll get one of these fancy microphone thing headsets many of you have. Sorry about this. Do you hear me now?
Yeah, it's okay. Go ahead.
Okay. Yeah, I mean, on this remdesivir thing, couple of short questions. First of all, when did you hear about the US decision exactly? How did you learn about it? Did the American government inform the Commission beforehand that they are going to do this, or did you learn about it from media reports? And then secondly, when did the Commissioner start her negotiations with Gilead on this matter? How did she calculate the amount of doses that are needed for the European Union? I mean, I wouldn't have any idea, but I mean, she must have an idea. So I'd be interested in how. And finally, how would it be paid for? Out of the EU budget or through other means? Thank you. I'm sorry about that.
No problem. When you say she, I suppose you mean Mrs. Kyriakides. Okay, Stefan, how did we learn about the decision?
Okay, thank you very much, Oliver. I have to admit that it was not extremely clear in my earphones, but I think I got the questions. How did we learn about the US decision? Well, to our knowledge, we were not informed by the US government about it, and we learned about it through the media, as maybe you have done. On the question when Commissioner Kyriakides started negotiations with Gilead, maybe I have to clarify here something. Commissioner Kyriakides is not in negotiation with Gilead. She has had many meetings with the pharma industry, including with Gilead, as they were working on a promising treatment. So many meetings have taken place. The Commission is now, as I said a few moments ago, having discussions with Gilead indeed to reserve a sufficient number of doses for the EU member states. How are the number of doses being calculated? Well, I cannot say a lot about this because the negotiations and discussions are still ongoing. It is expected, however, that we will take into account the actual needs, obviously, actual or prospective needs, which could be, for instance, on the basis of hospital admissions. As to your questions, how these deliveries will be paid, yes, this is something on which I cannot yet comment. We're a little bit early in the negotiations to give you any further information on that. So I'm afraid I'll have to leave it with this. Thanks.
Thank you very much, Stéphane. I do not see any other questions for us today. So we will now move to the technical briefing on the new programs for North Africa that I announced at the beginning of this midday briefing. Thank you very much.